The harmful use of alcohol is one of the leading risk factors for population health worldwide. Alcoholic drinks are a cause of various cancers, irrespective of the type of alcohol consumed. The causative factor itself appears to be ethanol. The evidence indicates that the more alcohol a person drinks, particularly the more alcohol a person drinks regularly over time, the higher his or her risk of developing an alcohol-associated cancer. Even light drinkers, defined as those who have no more than one drink per day, and binge drinkers have a modestly increased risk of some cancers. There is an established causal link between alcohol use and cancer development in the mouth, oropharynx, larynx, esophagus, liver, stomach, colon, rectum, and female breast cancer, both pre- and postmenopausal. The risks are generally higher for women than men. Even moderate alcohol intake has been shown to increase the risk of developing female breast cancer. Pathways by which alcohol influence cancer development include permanent damage of cellular DNA and inhibiting DNA repair mechanisms, leading to increased cell mutations and risk of developing cancer. Alcohol is also thought to modulate estrogen pathways, leading to the increased risk for development of breast cancer in females. In 2016, 4.6% of all cancer deaths were attributed to alcohol consumption in the Americas. The largest contributors to alcohol-related cancer burden were colorectal, liver, and esophageal cancers. If a person stops drinking alcohol, what happens to their cancer risk? Most studies indicate that stopping alcohol consumption is not associated with immediate risk reduction in cancer. Cancer risk will eventually decline, although it may take years. In some cases, oral cavity, pharyngeal, and laryngeal cancer, up to 16 to 35 years for the risks of those cancers to return to those of never drinkers. A recent paper published in 2018 sums up the health risks of alcohol very succinctly. Quote, "The risk of all-cause mortality and of cancers specifically rises with increasing levels of consumption, and the level of consumption that minimizes health loss is 0. Bottom line, the safest level of drinking alcohol is none."